and good evening, everyone. My name is Michelle Sang, a PhD candidate and senior CMC consultant at Therapeutics 360 Consulting Group in California. Today, I'm excited to present my poster on Connecting ADA-SCID Manufacturing and Outcomes, a case study in predictive analytics for product understanding. This work explores how we can bridge manufacturing processes with clinical results to enhance gene therapy for adenosine deaminase severe combined immunodeficiency, or ADA-SCID. Let's start with the purpose. ADA-SCID is a rare, life-threatening immunodeficiency where patients lack the enzyme adenosine deaminase, leading to severe immune dysfunction. Traditional treatments like allogeneic hematopoietic stem cell transplantation have survival rates of only 43 to 66%. Autologous gene therapy offers promise, but faces manufacturing challenges, including process variability and safety risks, such as the 2020 case of T-cell acute lymphoblastic leukemia in Strimbelis therapy. This case study compares two gene therapy workflows, a lentiviral approach using EFS-DA and a gamma-retroviral one using MNDA. By applying a predictive analytics framework, we connect incoming materials, process parameters, and clinical outcomes to optimize control and minimize risks. Moving to the methods. We based our analysis on established workflows from studies by Cohn et al. In 2021 and Ayuti et al. In 2009, summarized in Table 1. Workflow 1 is an 11-day lentiviral process. It begins with bone marrow harvest on day 0, CD34, positive purification on day 1, transduction with the EFS-D vector over days 2 to 4, expansion from days 5 to 10, and finally formulation, testing, and infusion on day 11. Workflow 2 is a shorter 4-day gamma retroviral process, bone marrow harvest and CD34, positive purification on days 0 and 1, transduction with MNDA on days 2 and 3, and infusion on day 4 without expansion. Key differences include the expansion step in Workflow 1, which boosts cell yield, versus the faster but lower dose approach in Workflow 2. Now, the results. As shown in Table 2, Workflow 1 achieves higher cell yields 5 to 10 million cells per kg, compared to 1 to 5 million in Workflow 2. Transduction efficiency is 80% for Workflow 1 and 70% for Workflow 2. Vector copy numbers are around 1 to 3 per cell in Workflow 1 versus 0.5 to 2 in Workflow 2. Clinically, both show 100% survival, but Workflow 1 has 97% event-free survival and no oncogenesis, while Workflow 2 achieves 90% immune reconstitution, but had 1 TL case out of 10 patients, per Ferroa et al. In 2019. Table 3 highlights manufacturing challenges. Low CD34, positive proliferation and suppression by CD34, negative cells reduce yields in both. Low transduction efficiency impacts vector copy number and ADA potency, leading to risks like failed engraftment in Workflow 1 and TL in Workflow 2. Figure 1 and Diagram 1 illustrate how integrating analytics, tracking metrics like vector copy number and ADA activity with clinical feedback builds process robustness. In conclusion, feedback from clinical outcomes can reduce variability in Workflow 1 by 10 to 15%, as noted by Gasper et al. In 2011, and likely improve Workflow 2 through better controls. Table 4 outlines the predictive analytics framework for incoming materials, enhanced pre-purification analytics to address poor proliferation. For in-process metrics, optimize stimulation in Workflow 2 to boost transduction efficiency and monitor integration sites to mitigate TL risks. Clinically, set VCN thresholds to ensure immune reconstitution. Overall, this framework predicts out-of-specification events, optimizes processes, and supports long-term safety and efficacy. It keeps manufacturing in a control state, critical for advancing gene therapies. I'd like to acknowledge the clinical trial investigators and patients who contributed data. No external funding was received, and I have no conflicts of interest. This poster is sponsored by Therapeutics 360 Consulting Group, integrating science and compliance. Thank you for your attention. I'm happy to take questions or discuss further.